Hi, everyone, and welcome to the special simulcast of the Neil Haley Show and Doctales. I'm excited to welcome the host of Doctales, Rural Doc, Alan Lindeman. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Doing fantastic. Our guest today is Dr. Charles Simkovich of Simkovich Concussion Institute. And I've asked him thousands of questions since he's been on my program. But during this simulcast, it's all going to be up to Rural Doc to ask the right questions about Dr. Charles. So go ahead, Doc, with your questions, Rural.
Well, Dr. Simkovich, I'm assuming that most of your concussion patients have some kind of trauma. Is that right?
Sure. Oh, yeah. Yeah. Either blunt force trauma from sports or car accidents, or coup contra coup injuries where they were whipped real hard, as in a car accident, or shaken baby syndrome, where you can have a concussion without even hitting your head. The brain is shaken, the neck is shaken so hard the brain actually bounces off the inside of the skull and then hits the opposite side. So there is definitely trauma.
So you treat young people, very young.
Oh, yes. We, as an example, we have a lot of Amish patients, and one of the Amish communities about an hour north of here, they routinely bring newborns in for well baby checks just from birth trauma. One day my wife walked in the office and there was an Amish lady holding a baby. And my wife said, "Oh, when was the baby born?" And this Amish lady looked at her and said, 3 hours ago. But it was a traumatic birth in the OB-GYN at Jameson Hospital here in Newcastle. The baby's head was banana shaped and it was pretty bruised. So he told this Amish lady, just to get down there. And this lady literally left the hospital and just came right down to the office.
So when you see somebody who's 3 hours old, what do you do with them?
Well, I typically examine, first of all, the sphenoid bone. The sphenoid, as you know, articulates with almost all the other cranial bones. And from our research, we found that it actually flexes and extends. So it kind of moves all the other cranial bones, the temporal bones, the parietal bones, the occipital bones. And also it houses the pituitary gland. So a lot of our early research, when we really had nothing to look at. There was no precedent for head injuries. So we just looked at everything. We did CT scans of the brain, MRIs, blood work. We even did urinalysis, even sputum. Because there was nothing out there. So one of the findings we found on CT scan was empty sella, which means there's damage to the pituitary gland. So then we started correlating it with blood work, and we found quite often hypothyroidism, various hormonal problems, things like that. And then symptom-wise, a lot of people after concussions have irritable bowel syndrome. And so over the years, this has all been quantified. So a lot of the newborns, the parents brought them in because they were fussy, or their heads were misshapen, not nursing correctly. A lot of the mothers will tell me if the baby nurses on one side, they're fine. The other side, they can't at all turn their head and they cry. So just various things like that. Where there was sort of abnormalities, especially with parents who had multiple babies. They could compare that this child was struggling compared to the other children.
Can you tell me a little bit about this 3-hour-old baby? What did you send the mother home with? What did you tell the parents?
Well, on examination, we found that the pterygoid processes bilaterally, which you can access through the roof of the mouth, were really dropped. You can palpate them and feel them. The parietal bones, the parietal ridge was not symmetrical bilaterally. There was one side of the parietals that were really dropped. And then you could feel the greater wing of the sphenoid was really projecting superior on the right. So there was actually a gentle treatment where you apply pressure to these to just kind of get the cranial bones moving, to give this baby relief. And there was actually too, the atlas was bilaterally anterior, very badly. So you adjust these cranial faults, and usually infants respond very quickly because they don't have a lifetime of trauma. Things aren't, multiple injuries over multiple years. So usually they respond extremely quick.
So what kind of follow-up did you have for this 3-hour-old baby?
I usually have the parents bring them back in a week or two, just to check and make sure they're fine. I do give the parents instructions to watch the baby. If the symptoms worsen, let me know, because there might be some other intervention we need to do. There's also, conversely, I say, if this baby is symptom-free and sleeping and eating and looks fine and their color's fine, there's no jaundice and it's healthy, then go ahead and cancel. But every once in a while you find a case that's a little tougher. Like we had one case where the baby, it was clear they were showing all of the symptoms of a tethered cord. So I sent them to Children's Hospital here in Pittsburgh, and this boy actually had to have surgery. We also had an Amish baby that was in very distressed and yellow, and when the mother brought him into me, you could see the baby had actually given up, and I said, get him to the emergency right away at Children's. And here he had no small intestine. The spleen and the liver were switched sides. Make a long story short, the baby had to have extensive abdominal surgery, and he's doing fine now. He's home, but it was a pretty critical case. But after a while, you start to as you know, in your practice, you can root out these harder problems and realize they need different things. So in a way, for a lot of these patients, I'm a clearinghouse where I can send them the right direction.
I imagine that as people get older, they present with headaches a lot of times. Is that right?
Yeah, yes, the symptoms for concussions are I don't know if you've been to the restaurant Cheesecake Factory. Their menu is huge. It's pages and pages and pages. So there's a lot to pick from, and that's what concussions have become now. When I started doing our research in '86, we knew it caused pain like headaches, or it caused cognitive issues like memory problems or reading problems. So now the list is just getting bigger and bigger. I have a lot of people after their concussions they lose their sense of taste and smell, memory. Now with our awareness of the glymphatic system and the waste removal system of the brain, we know that tau proteins and beta amyloid proteins can build up, which can lead to dementias and brain disease like CTE. We have people who develop TMJ, with which the internal and external pterygoid muscles attached to the sphenoid, so they influence how the sphenoid moves. And I have a great ICCMO doctor here that I refer to. It's the International College of Craniomandibular Orthopaedics, and she does wonders with TMJ. So it's a matter of finding the right thing. But yeah, the symptoms from concussion are getting bigger and bigger. The NFL alone, retired players are 5 times more likely to have erectile dysfunction, and that's because of the pituitary damage, which controls as you know, the pituitary is the master gland. It's like a general in the army. It gives orders. Yep. So yeah, we have the symptoms are getting really great. I had a fella here in Pittsburgh who was in a motorcycle accident, and his helmet actually saved his life, but he was in a coma for 2 weeks. Once he got out of the hospital, he came to the office, and the third day he said to me, he goes, my color vision is back and it's vibrant. And I said, you never told me your color vision was gone. He said he didn't realize it was gone until it came back.
My gosh.
So yeah, when I started doing this in our findings, I started reporting that I felt hypothyroidism was from concussion, and I basically got laughed at. And now there's study after study after study about hypothyroidism they believe is from concussion. Now they're leaning towards ALS. We haven't had a case of POTS go not resolve after treating concussion. So we now think POTS is a result of concussion, and POTS is postural orthostatic tachycardia syndrome. So a lot of people think they're having heart issues, and now there's pretty good proof that we think it's from concussion.
It's great, and it's crazy. Dr. Charles, explain the research to Dr. Lindeman about what you've found first yourself, and now research is proving that you are correct about what you've been able to do for patients.
Yes, it comes down to anatomy and physiology. When you look at the structure of the sphenoid, and it obviously articulates, so it influences other bones, houses the pituitary gland. It houses the pineal gland, which regulates serotonin secretion, which is what's a problem during PTSD. You have your eye muscles actually attached to the sphenoid, which is going to affect tracking. So we have people like kids who are struggling in school with learning problems. They can't read. They might reread the same line over and over, or skip words, or lose their place. It's because the eyes aren't tracking, because the eye muscles are influenced when the sphenoid might be tilted. And so some of the eye muscles are elongated, some are shortened. So we have an eye tracking issue. Then you add to that 3 cranial nerves, 3, 4, and 6, pass through openings or foramen in the sphenoid, oculomotor, trochlear, and abducens. And so the nerve supply that control eye movement can be affected. Then the optic nerve passes through there. Then you have the addition of the jaw muscles that attach. So it's like Grand Central stations. And due to the structure of the skull, since it's dome shaped, almost every blow transfers the forces right to the middle because of the dome. And so the sphenoid actually absorbs everything, and it can do a lot of various things where it causes aberrant motion of the sphenoid. So that's our focus. And of course, the temporal bones can be involved, and the parietals can drop. But there's a whole a system of things that can happen from these head injuries.
I have twins, and one of them, at least I did when I was practicing, and one of them had POTS, but they were in vitro. So, there's a lot of things that pop up in vitro pregnancies. So I think POTS is probably one of them.
Wow, that's amazing. When I started doing this work years ago, the forceps were causing quite a bit of problems. I spoke to a concussion group here in Pittsburgh, and one of the patients was an OB-GYN, and he was saying, he's retired now, and he was saying he saw a lot of issues with forceps deliveries. And he said vacuum extractors to a lesser degree, but even Pitocin, he said, when you induce somebody, he said, it brings the contraction so hard, sometimes it's a little hard on the baby. That was his opinion.
Well, one thing I've never liked to do is rupture membranes with an unfavorable cervix, because I've delivered about 6,000 babies with no maternal mortality, but I never have liked to rupture membranes early and use the baby's head as a battering ram. And we don't have any studies on what kind of trouble that causes, but it sounds like it might be right up your alley.
Yeah, we would. I know we've had several OB-GYNs around here who really are intrigued by this and very interested. I get a lot of referrals. The work is getting widespread. I have a pilot who approached me. I do research with Wheeling University's doctoral program of physical therapy. We've done 5, with one's published, another one's going to be published. We're on our 6th one, and they've asked for an ongoing relationship, which their lead researcher is Dr. Mohammed Haddadzadeh, and he's a brilliant researcher, and Dr. Christine Grubler. So they do a very comprehensive job of research. I'm lucky to be associated with them. But now, when the word's gotten out with that, this pilot who flies for NetJets has said, listen, the FAA would like to see the effects of these pressurized cabins on their pilots, because he said, even though they're pressurized, the higher we go, he said, he feels it after a long trip, and he knows he's mentally foggy. So he would like the FAA to join us and do some studies on it, which I think he makes sense. And that's kind of similar to a baby being in a pressurized cabin, if you think about it.
Well, I really like to keep the bag intact, because with that, you deliver that force over every square centimeter of that baby instead of right on there or there.
Yeah, and that makes sense to me. I think that makes a lot of sense.
Oh, wow. It's Doc, do you have any more questions for Dr. Simkovich?
I have one more question. For many years, I practiced in healthcare deserts. And then, of course, that means that I see everybody. One of the problems I've had with head injury patients, say, for example, somebody has a head injury while they're working for a train company. The first thing that happens is the train company sends out a bunch of lawyers that says it's not their fault, it's the fault of the patient.
Right.
But the next big problem is that these people a lot of times simply can't access any system at all because they're too addled. They can't fill out the paperwork.
Right.
So I imagine you see some of those.
Oh, they're compromised. Yes. When patients call, my staff is very trained to realize they're compromised, and they're going to have a hard time answering questions. And several times I'll have somebody and the paperwork's not filled out because they're incapable
Right.
due to the trauma. So yeah, that's very real. And then, a lot of the cases have been mismanaged. The claims that I see come into my office, I actually have a patient. She, I don't know if you heard about the shooting in the synagogue here 4 years ago where 11 people were killed. This patient was actually in the synagogue hiding in a bag of clothes. She survived, which is miraculous. Anyway, she ends up subsequently has a concussion. She ran into tempered glass window of a door that was closed all the time at her workplace. Well, she went to the work doctor and for this concussion before she found her way to me. And this neurologist actually told her there was no difference running into tempered glass than there is getting hit in the head by a cotton swab. I mean, I almost fell off the exam table. I said, it's crazy hearing a statement like that by a professional. But the access, we're trying to fix the access. I work for the NHL Alumni Association, and they're actively working with me to start to train doctors to put them in cities around the country. Dr. Amin Kassam is their chief medical officer. He's a brilliant neurosurgeon. He's actually the one who pioneered removing brain tumors through your nose, so you don't have to split your head open. And he has a company called Nika Medical that's looking into getting more doctors trained and placing them around the country so that everybody has access to this. Because right now it's me. So
exactly.
Well,
So yeah,
you're doing something that's needed. Yes.
It's so needed.
It's a true pandemic.
Yes, for sure. Best place we can find information on you, Dr. Charles, go where?
Simkovich Concussion Institute.com. And if you type in Dr. Simkovich, my website pops up.
Most definitely. It was great information. Appreciate it, Rural Doc. All right.
Thanks.
Thanks.
Appreciate the opportunity to talk with you.
All right. That was the special simulcast, the Neil Haley Show and Doctales, guys. Take care.